In 2003, a previously unknown respiratory illness spread to Canada. SARS was an epidemic that caught health officials off guard.
SARS was a very scary event, I think, in healthcare because there was a lot of unknowns and the impact that it was having on healthcare providers and on healthcare systems around the world. It really highlighted how we really could have worked better together as a system.
My predecessor, the deputy minister at the time, his comment about the critical care system was that we simply know nothing about it back in 2003.
It's been quite humbling to see the growth and development of the strategy over the last decade. We needed to build a system so that we can meet the needs among the most vulnerable of Ontarians.
And you know, one of the remarkable things today is that moment to moment in real time, we have an understanding of where the critical care beds are, what types of patients are in critical care. There's been a remarkable system transformation.
CCSO has started a number of initiatives that have really made a difference in terms of performance within the critical care system. Two things that really stand out in my mind that really make sure that we get the right patient in the right place at the right time would include the critical care response teams and our Life for Limb policy.
They set up referral patterns for certain specialties. They set up rules around who should respond and how fast they should respond. So now we can actually do the job better than we've ever been able to do it before.
We were probably one of the largest jurisdictions in the world to have a common information system for 202 critical care units across a province of 13 million people. One of the other things that we did was work with the nursing field to create a standard of training for critical care nurses. So being able to have a strategy that improved our health human resource capability really then complemented some of the other strategies that we were trying to implement.
Critical Care Services Ontario has just completed an exciting strategic planning process in collaboration with a broad range of stakeholders across the province. The plan is based on a number of inputs, including a literature review, stakeholder consultations, and a capacity, utilization, and forecasting analysis. The plan is comprised of 5 strategic goals.
Families must be welcomed into the circle of care. They provide comfort for the patient. They are a safety net as they know the patient better than anyone else, and they're a valuable member of the healthcare team.
I got ill and I was in ICU for several weeks.
You know, a social worker had come to speak to me about what Jason was like pre-illness, to understand his sort of psychological state, because they're really concerned about how to care for him when he does wake up.
That's where the critical care information system comes in terms of enabling us to have the data to be able to measure and monitor and evaluate, and then subsequently to tweak the program if we had it to. So to highlight where the program may not be working well, using the data and the evaluation to say, okay, here's how we can make this better.
Some of the quality monitoring initiatives, such as the balanced scorecards that have been created for hospitals, LHINs, and the whole province, have made a huge difference in giving us information so we can then see where we're performing well, where we're not, and really gives us some clues as to opportunities to try to improve the care that we're providing, and we'll do a better job working as a system.
Getting EMS involved with CCSO to get our take on improving transport decisions and making transport more available for patients. That allowed us to talk more broadly with my colleagues across the province and really collaborate with CCSO so that we could be in line with things like repatriation and also transport decisions to get critical patients to trauma centers or other specialty centers across the province.
It's so important to focus on patient flow and transitions through the system, as patients are no longer just moving from the ICU into other parts of the hospital. Patients are now moving from the ICU into a community setting. For example, patients that require long-term mechanical ventilation are moving directly from the ICU into community settings.
I think the emphasis on innovation, looking for new opportunities to do things in a better or different way, looking for new ways to work together as a team and a system. These are going to be important initiatives over the coming years to really make a difference in terms of how we provide quality care to patients who need critical care throughout Ontario.
CCSO is committed to translating these better ideas and practices into action. We will provide leadership to ensure that clinical best practices are identified, disseminated, and integrated across Ontario's critical care system.
Interprofessional, collaborative critical care teams make a huge difference to patient outcomes. They make a big difference to the patient and family experience. Ultimately, it enhances patient safety.
We need to work together, and in order for us to do that, all the different professions in the system need to learn our different roles, how we can work more closely together, how we can work more efficiently together, and so I think the focus on interprofessional teams is going to be key.
What we have now is a map for the next 3 years to say these are the areas that we need to focus on.
I think having an organization like this around and having a strategic plan and having the vision for it makes patients and families feel more comfortable and assured that both the patient and family is being taken care of.
As a patient in Ontario, if I needed critical care, I would feel even more confident over the coming years that I'll get the care that I need in a timely manner and that I'll have the best chance for a good outcome.